have in India is called Bos indicus. All the other cows in New Zealand, in Australia, in America, in Europe, they are called Bos taurus. They are a different breed. And now medical science has shown us, and this has been accepted by the Americans, and I'll tell you in what form it is now manifesting itself, that the Bos indicus milk is of very superior quality medicinally. It has medicinal properties which the other milk don't have. And therefore, in America now, in supermarkets, you get cartons saying Bos indicus milk from the cows from India. And they cost 4 times more than the milk from the American cow in the supermarket. So, Bos indicus is now being recognized for its medicinal value. The milk is being recognized for its medicinal value and its superior quality. 2, the use of the dung, which can be converted to almost as solid as a brick. And in fact, there is a factory in Nagpur which has now started doing that. Easy to get building blocks to build huts and for the rural areas. So that's another contribution that the cow makes. Cow urine is always been considered a great medicinal value. And urine is used in even Western medicines, but they get the urine from the laboratories, public laboratories. Whereas this one is something which we get from the cow, that's also could be used for medicine.
Hi, we have lost we've lost Jagdish ji. Okay, welcome viewers to another edition. This is actually our 103rd edition of Words of Wisdom Gyan Ganga. As usual, this is actually also our first anniversary year. So we started Words of Wisdom on April 2nd on Ram Navami. So technically, this is our anniversary edition. So, and it's an exciting show today. So, I mean, we have some fascinating topics. One that is, typically that is having an impact across the globe, which is Corona. And Dr. Swamy, in his earlier episodes, as you've seen in the promo also, we've been talking about the advantage of, what the Bos indicus, the cow that, that it has helped in the past, and Ayurveda, which are well-known science that has been there for tens and thousands of years. So we're going to talk about a protocol that has been developed by the Bhaktivedanta Institute in Mumbai. We have Dr. Sankey with us. We have Dr. Vijay Kumar Gavli and Dr. Memane. He'll come on the show pretty soon. As usual, VHS being headed by Dr. Swamy, you all know, so we don't need much introduction for Dr. Swamy. We have Dr. Arvind Chaturvedi, who's the co-host on the show. Shortly, we'll have again Jagdish Shetty ji also online. For now, because there is some technical difficulty, so Jagdish ji is not able to join us now. So with this, I will ask Dr. Swamy to briefly start and give a quick introduction about this. And then we can just then hand it over to Dr. Sankey and the team to go ahead. Over to you, Dr. Swamy.
Yeah. Okay. Thank you very much for coming with your colleagues. And I've seen the team you have set up. It's really high to have fruition for the sake of the country. And we are thanking you for coming here and sparing your valuable time. State PHS president, so you also have a responsibility. And we have a claim on you. The cow is concerned, the Bos indicus, that figures in our constitution. And if people have a wrong notion, directive principles is not binding on anybody. That's not true. Article 37 of the Constitution 37 of the Constitution, it says that the directive are binding on the government to implement. The only thing is that I, as an individual, cannot go under article being violated by cows being butchered. That individuals don't have a right to enforce these public policies binding on the government. Some time ago, I was lucky enough to get my resolution on the cow, and it became item 1. And I was very surprised that across the aisle, every party spoke. Although the BJP parliamentary office had issued a whip that vote for this bill because it's not an official bill. Nevertheless, the MPs all said that the Parliamentary Affairs Minister came to where I was sitting and pleaded with me that it will cause a chaotic by our own MPs. So please withdraw it. I said I can't withdraw it because so many people. The deputy leader was a Muslim, and he said that it's wrong to say that Muslims don't want to ban on cow slaughter. Is worshipped by the Hindus, and we respect that. So only maybe some fanatics are saying like that. But the fact who take pride in eating beef. Some even say these American cows you can eat because they're not Bos Indicas. It's tremendous consensus. But the cows are, after they cease to give milk, are put on the road. The question was raised by the minister. So the minister came to plead with me as directed by the Prime Minister that go and plead with him that please withdraw, we'll bring an official bill. I said no, not only will bring an official bill, but you will have in my my motion or my resolution. So that also he agreed. He did not, and so far the government has not, kept their assurances. I kind of government, but not proper. I think we should put pressure on the government to. Beginning, they are accepting, and Bos Indicus cows. We have almost 50 million cows in our country. The Israeli cow gives you 11,000 liters per year on the average. Imagine 5,000 liters, how much milk we'll have, and it's already, even this present thing, we have this problem of all these barriers which we must fight for in the WTO. So I think what Mr. Dr. multifarious aspect of the cow, and we all want to learn from it. So I don't want to stay in the way. So please tell us what you want us to know about the cow.
Yeah. Thank you, Dr. Swamy.
Thank you, Dr. Swamy.
And the entire VHS national team and the technical team of the Yan Ganga. We have witnessed last year the pandemic of COVID-19 beginning in India. It became a serious issue post-March 2020. And then we saw a rise in the cases and then slowly a decline towards October, November. We were a little bit relaxed, off guard. Things started almost like normal. But by the end of February and March, beginning of March, a second wave was very apparent, particularly in Maharashtra. And as of today, again, we are surging with cases. Today's statistics is saying that total cases in India, active cases are 6,91,000. And out of that, Maharashtra alone has 4 lakh cases. So almost 70% share is in Maharashtra. So of course, Maharashtra is also doing the maximum number of testings, and that is why we are detecting cases. What we witnessed was that our own dedicated COVID hospital, we had almost closed it down and started non-COVID services because the patients were not there. And then we realized that now the cases are increasing. And one day we again restarted the COVID cases. And within 2 days, we immediately had 39 cases admitted. So we can see that there is a rapid surge and the people are getting affected like wildfire. Families are getting affected because now it is no more like tracking, tracing. That is not so easy now with so much of spread. So in the beginning of the pandemic, towards July last year, I was approached by Professor Ganesh from IIT and his friend Umakant Gaikwad, who represents the Sarveshwar Sahakari Sanstha, which is for the cows, that they have done an excellent job in Dharavi, which is part of Mumbai, where thousands of people were treated by a medicine through cow urine and some other combination. And why don't you try it? Of course, at Bhaktivedanta Hospital, we always follow the evidence-based medicine. So I said, do you have any data? So they didn't have. Then I said, I'm ready to do a proper research and then we'll look at it. So we did the research and the results were fascinating. We have sent it to journals and it is under review right now. We sent it to the Ayush Ministry also. About 4 communications have gone to Ayush Ministry. They have not responded whether they would like to implement it. But of course, we have all the permissions for doing our own thing. So the whole data was so much impressive that we thought that now we should come directly in forefront and start treating the people. Like in this coming week, I am meeting even the municipal commissioner of Mira Bhayandar area so that it can be officially introduced in the treatment protocols. But at the same time, Bhaktivedanta Hospital is already using it and we are seeing very good results. And it is all glories to the Gomata, the Indian cow, Bos indicus, that it is such an effective medicine. And I'm very proud member of VHS that we have always tried to promote the cause of Bos indicus, the Indian cow, and in general cows. So very grateful to Jagdish ji, Dr. Swamy and everyone that at a short notice, because last Thursday, we presented it in my VHS Maharashtra group in the program called as VHS Virat Abhyasika, and everyone liked it. And Jagdish ji immediately said that we can do it on Sunday in the Gyan Ganga, and that's how now we are streaming this live. And I would request now Dr. Vijay Kumar Gavli to actually give a scientific presentation on how we did this research and what are the results. Over to you, Dr. Vijay Kumar.
Dr. Vijay Kumar, your mic is muted, Dr. Vijay Kumar.
Yeah. Thank you, Dr. Ajay Sankhya, sir, for this opportunity. Thank you, Dr. Swamy, sir, for this opportunity and this offering this platform to share the results of a very important activity. I would like to show a PowerPoint presentation. So now I would be sharing my screen and I would be walking you all through clinical trial results which we have received. Yeah. So is this viewable now?
Yes, go ahead.
Yeah. Sir, so we know that the vaccine is out now, and people are, and the confidence we have in getting administered with the vaccine is because the clinical trials are done by the authoritative people under proper regulations and approvals. In the similar fashion, we also wanted that this particular medicine to go through a rigorous clinical trials so that the data is acceptable, presentable throughout the globe. So this is the team, sir. There are a few doctors headed by Dr. Ajay Sankhe who inspired, encouraged the entire team to undertake this important task so that we can save the world. We also had few professors from IIT Bombay. Apart from the clinical evaluation, which as a doctors we were doing in the hospital, we wanted objective elements and we wanted the samples of the patients and samples of medication get analyzed at the best laboratory possible in the country, which is one of the IIT Bombay. So we have a team from IIT Bombay and obviously Sri Sarveshwar Seva Sahakar Sanstha, which was mentioned by Dr. Sankhe.
Dr. Gavli, can you hide that thing? Can you click on hide on that StreamYard in the bottom? So that
Yeah, thank you, sir. So I was telling that any clinical trial to be conducted in any country, there are certain rules, regulations, laws to be followed. The first is that the ethics committee, which is registered with Department of Health Research, Health Ministry, Government of India, has approved this particular clinical trial. The trial is registered with the Clinical Trial Register of India, and obviously the trial is also submitted as per required to the Ayush Ministry. This is our team. So we went to various dedicated COVID hospitals which are run by the government. We received the requisite approvals from the designated commissioners to conduct the clinical trials. This team was encouraged by Dr. Sankhe to take the risk and to go out and conduct the clinical trials on the COVID-19 patients. So we had divided the patients into two groups. This is the standard way of doing any clinical trials. The control group, which is pink in the color, 60 patient, and another group, which is intervention, 60 patient here in this group. The first group, control group, got the standard of care, the allopathy medications, which are given by the Government of India. The another group, intervention group, where there are 60 patient, even that group received the standard of care and additionally received the medication Ayurcoro 3, which we are discussing today. The Ayurcoro 3 medication is derived from, as Dr. Sankhe mentioned, the cow products and few other principles in that. This is brief study procedures. We noted clinical features of the patient before administering the medication. We did certain laboratory tests also, and we repeated the same examination after 2 days of administration of the study medicine Ayurcoro 3. And we also analyze the patient at discharge and also post-discharge at week 1, week 4, and week 6. Now, we can see here the results just after consumption of 2 days of this medicine. The results are very encouraging. I will request all the viewers to follow the aqua color. This aqua color would represent the group where the patients have received the Ayurcoro 3 additional medicine, the special medicine which we are discussing today. Symptoms have displayed cough, breathlessness, tastelessness, and fever. And we can see that the 84% patients got relieved of their cough in just 2 days of the medication administration. Breathlessness, 92% patient got benefited. Immediately, the breathlessness symptom was gone. The tastelessness, the patients are losing the taste in COVID-19, and thereby they are not being able to properly have intake of food and then losing the immunity. So even that problem get resolved in 75% patients. The fever in just 2 days get resolved in 88% patients. There are a few statistical calculations we have mentioned here on the slide. The another important objective assessment of this clinical trial was the RT-PCR test, which is very popularly known for the COVID-19, where we did the cycle threshold values. And we did those values before administration of the drug. We repeated those values after administration of drug also. So what we observed was in the Ayurcoro 3 group, the benefit was almost double. So the RT-PCR values got better by 10, and in the another group only by 5. So the double benefit was observed in the intervention group. We can also see that the individual patient values I have displayed here, which tells us that in the intervention group, the values are better. They are on the better graph, and they are not on the negative graph. On contrary, we see in the another group where the patient did not receive IOCORO 3, there are few patients where the values are negative. So these values are not better. So when we say that these laboratory values are better, we mean that the virus is low. And in just 2 days, if we can reduce the viral load, so thereby the infectivity and better chances of recovery in the patients. So the problem doesn't end just when we discharge the patient, because even after discharge, the patients are expected to resume their daily routine activities, which is not somehow then unfortunately not happening. So we wanted to see what happens after discharge, and we are very happy to know that at day 7 post discharge, at day 20 and day 42, when we interacted with the patient, 87 patients were resumed immediately their daily routine activities, and they were happy about the medication. And at day 22, 92%. So this aqua color, you can see that in the patient who received IOCORO 3 immediately, quickly could achieve their normalcy. So not just the inpatient care was improved, but even after discharge, they were immediately quickly could start their daily routine activities. So the one trial is certainly not sufficient. So we went for the second clinical trial at the dedicated government hospitals. Again, obviously, the ethics committee permission was obtained. The trial was registered with the Clinical Trial Registry of India. And of course, the documents were also submitted prior to the Ministry of Ayush. Again, we had two groups, as we explained, that the randomization technique was used so that the data is accurate, credible, presentable, and acceptable internationally. And here we increase sample size, increase more patient to authenticate the data. So we have in the control group 87 patient, and our IOCORO medication group 87 patient again. These two groups are important so that we compare and we see which one are getting better. Here, we elaborated the clinical examination, we increased the frequency, we examined the patient after 2 days, after 5 days, and after 7 days at discharge, and again a week after discharge. So at these intervals, the entire team examined the patient very closely to ensure that the proper data is collected. And what we see in the second clinical trial, if we see the curve, at just after 2 days of medication at day 3, 60% patient got improved. And we can see the benefit at day 5, day 7 at discharge. The above line, which you can see in the aqua color, is for those patients who received IOCORO 3 medication. And the below line is for patients who were in the control who received only allopathy medication. And there are certain statistical values, and the tests are also displayed here for better understanding. Even the breathlessness we can see at day 3 itself. The 50% patient immediately got relieved of the breathlessness. And we can see the bar is up for this particular group, even at day 5, day 7, and discharge. Regarding the testlessness, again, the result we got in the first trial, they are confirmed and affirmed in the second clinical trial also. Even in this trial, the patients are doing better, and this complaint is relieved in most of the patient just in 2 days of consumption of this medication. Even in terms of weakness, we can see that the upper line, which represents the group which has received IOCORO 3 medication, there are more percentage of patients showed improved with this symptom also. We also wanted to see the mortality, and we capture the data about the death. In this intervention group, which received IOCORO 3, no death, but in another group, we saw more number of deaths. So with this data, we are not sort of claiming that there is zero death rate, but this is so assuring and relieving to know that there were no deaths when the patients are consuming this particular medication. Now, I would like to invite my colleague and friend, Dr. Nana Sahib Memane, to walk us through the rationale of the study and what is the basis and why this medication is acting so dramatically, so quickly, and the uses of this medication. So over to my friend, Dr. Nana Sahib Memane, who is heading the Ayurveda department at Bhaktivedanta Hospital.
Thank you, Dr. Vijay Kumar, sir. And Rameshji, sir, I have sent actually YouTube link to your Gmail. You can show the video afterwards.
You just tell me when and I'll show you the video. No problem.
Yes, okay, no problem. So now, as very nicely explained by Dr. Sankhya sir and Vijay Kumar ji, first of all, I would like VHS National and Dr. Swamiji for giving us opportunity. So as we see the signs and symptoms of COVID-19, actually they matches with the Sannipat Jwar mentioned in Ayurveda Charak Samhita. You would see the Sannipat Jwar is a condition where all the doshas are affected. Generally, we see one or two doshas are affected, but all the three doshas are affected. That creates vulnerable condition, and of course, the text of Ayurveda also they consider this as a difficult to cure. But fortunately, the sign and symptomatology of one of the 13 Sannipatas fever, we could see the medicine which we have selected as per allopathy background and as per Ayurvedic textual background. So we could see that the medicine which is simplified but it acts simultaneously on all the doshas. And there are many medicines which act on simultaneously all the doshas in plants specifically, but they take 7 to 15 days to act on all the dhatus. But specifically, this medicine, which is actually distilled cow urine, specifically Indian Bos indicus cow urine distilled. So we have seen that it acts within a day on all the doshas. That is the beauty of medicine, and it is also proven by modern science that it is a bioenhancer. It actually uh, increases the absorption and the efficacy of allopathy medicine as well Ayurvedic medicine. So we have seen this IIT lab. The red colored highlighted words they actually denotes that the findings are present findings which we have done in the lab. The combination of our kit actually it shows antiviral, antibacterial, immunity booster, and antioxidant properties, also anti-inflammatory properties. That plays a role where sign symptomatology progresses there as per mentioned by Dr. Vijay Kumar. Next slide. So as explained by Dr. Sankhya sir, it is very simplified and half day dose. Within 8 hours, dose is finished. Before lunch, there is a gargle. After lunch, 1 hour after lunch, there is a first dose. 2 hours after first dose, there is second dose, and 2 hours after second dose, there is third dose. And believe me, within second dose, we could see that perspiration of the patient. As the concept of Ayurveda goes, there is a toxins which is detoxified with the help of this medicine very quickly, and everyone can experience the perspiration which reduces fever naturally. That's why fever goes within 1 or 2 days, and the cough and the doshas are toxins are actually thrown out. We need to target the sign symptoms on time. The basic principle lies here. There are 6 stages of disease development, out of which if we target the disease within 3 to 5 days of onset, that is accumulation of toxin, multiplication, spread, chai prokop prasar. With before spread, if we target the patient with this medicine, we get great results, and we can actually prevent the tissue damage which takes place in the form of pneumonia or pneumonitis, because when it takes pneumonia pneumonitis, then things become worse, though then multidimensional approach is required. So who can get benefited? Those patients who are actually flu patients, even though they are non-COVID patients or COVID patients, even healthy individuals. We have seen that one of the professor, he called just 2 3 days back, he said, sir, my whole family is positive. So I said, you are taking our kit monthly, so how this happened? So he said, sir, only I was taking the kit, but my family was not. So my 3 years old child, 6 years old child, and my wife, three of them are positive, and I am still not positive. I am taking care of them. So before getting COVID or contacts of COVID, friends of COVID patients and upper respiratory tract infections, even practically we have used COVID warriors, hospital staff, school children. So this has given very great results. So next slide, please. So our proposition is that if on time we reach to every family, then many complications actually can be prevented. And even though patient has got COVID, there also we can prevent them. And even though those who are healthy patients, healthy people, they also can be saved with the help of these medicines actually. And this help in non-COVID viral infections also we have seen that. So this is our website www.ayurkoro3.com, ayurkoro3.com, and there is hotline. Two numbers are there. Online also you can go on website. There you can uh, order the medicine, and it is actually couriered all over. In fact, we can take this as an opportunity to.
I'll play the second one now.
Yes.
minutes. The last part may not be displayed.
So Shashank Baliji is the director of Bhabiji Ghar Par Hai. Yeah. So I would like Shashank ji to speak about whatever experience he has. 1 to 2 minutes. You can share the experiences. So very warm welcome, Shashank Baliji.
थैंक यू सो मच डॉक्टर साहब. मुझे जो है वो वायरल लाइक सिम्टम्स है और वेरी ऑनेस्टली मुझे और मेरी वाइफ दोनों को और मेरी डॉटर को भी घर पे हुआ, तो हम इस इम्प्रेशन में थे कि हमें वायरल हो रहा है. तो मैं डॉक्टर साहब के पास गया और डॉक्टर साहब ने वो दवा बताई और बोला कि ये आप ले लीजिए और ये वायरल के लिए भी है, तो यू हैव टू टेक इट. तो इवन दिस कोविड इट विल हेल्प इमीडिएटली. एंड आई केम बैक और मैंने ये मैं आपको बात बता रहा हूँ, जब मैंने ऑलरेडी 2 हफ्ते की एलोपैथिक एंटीबायोटिक कोर्स सब कर लिया था, मेरा थ्रोट ठीक से हील नहीं हो रहा था and there was mild feverishness throughout, and later on I realized that I have lost my sense of smell and taste also. तो वो दवा जब मैं घर आया और जैसे उसने लिखी है मेरी लंच से पहले आपको गार्गल करना है और उसके बाद आपको लंच के 1 घंटे बाद आपको पहला डोज लेना है, तो मुझे डॉक्टर साहब ने बोला था कि शाम तक आप ऑलरेडी बेटर फील करेंगे. तो मैं उस उम्मीद में था. And I did not really feel better very honestly, पर मुझे अंदर से बहुत गर्मी लगी, जैसे कि अंदर सिर्फ बुखार हो रहा है और मैं टेम्परेचर ले रहा था तो बुखार नहीं था. और फिर मैं रात को अपना पूरा वो कोर्स लेके सो गया. मेरी आँख ऑटोमेटिकली सुबह 4 बजे जब खुली तो मुझे ऐसा लगा, जब मैं उठा बाथरूम जाने के लिए तो मुझे ऐसा लगा कि मेरी बॉडी में इन्फेक्शन है ही नहीं. I am infection free, absolutely. And that is the time when I came out of the bathroom, I slept again, and when I woke up at 8, I thought that my throat had healed, and मुझे लगा कि मैं perfectly free हूँ, लेकिन मुझे डाउन लग रहा था, कमजोरी लग रही थी. तो मैंने डॉक्टर को फोन किया 11 बजे, and डॉक्टर साहब सेड कि आप यू आर इन्फेक्शन फ्री और आप 2 दिन आराम करिए, आप ठीक हो जाएंगे बिल्कुल. और वही हुआ. मैंने 1 दिन आराम किया एंड आई वाज एब्सोल्युटली अप. उसके बाद में जब एंटीबॉडीज का एक बार मैंने टेस्ट कराया तो आई हैड प्रॉपर एंटीबॉडीज व्हिच आल्सो आई शोड टू डॉक्टर साहब. एंड द सेम थिंग हैपेंड विद माय वाइफ. द सेम थिंग हैपेंड विद माय डॉटर, जिसको मैंने 50% डोज दिया. मेरे फादर 83 इयर्स ओल्ड हैं, उनको भी उन्हीं दिनों में वायरल हुआ था और मैंने जो है वो यही दवा लेकर के. मेरा एक फ्रेंड है, उसको प्रॉपर बहुत बुरी हालत थी. उसने जब मुझे फोन किया, हमने ड्राइवर भेजा, हमने वो दवा मंगाई एंड ही फेल्ट द सेम थिंग, लॉट ऑफ हीट इन द बॉडी. द फर्स्ट डे ही गॉट स्कैर्ड आल्सो. अगले दिन से वो बेटर हुआ. उसने कुछ दिन आराम किया, उसको कमजोरी थी. बाद में जब उसका एंटीबॉडीज टेस्ट कराया तो ही हैड कोविड, व्हिच आल्सो वेरी ऑनेस्टली हमें नहीं लगा था, लेकिन वो वायरल समझ के हमने किया. लेकिन सबकी एंटीबॉडीज निकली तो हम सबको उसी टाइम जोन में हुआ. और ये जो दवा है, मैं क्या कहूँ, ये वंडर ड्रग है आज के टाइम में, because all the allopathic medicines that I took made no difference. The antibiotics were this thing, मतलब वो नहीं असर हो रहा था.
रमेश जी, हम अभी क्लोज कर सकते हैं इस वीडियो को.
भगवान की कृपा से जो.
थैंक यू.
Yeah. So just
That's it, Swamy ji, Dr. Swamy ji, and Dr. Sankhe ji from our end.
Yeah, so I'll speak just few words more before Dr. Swamy can take over. So we have seen that the results are excellent and they are replicable. We have seen it in 2 trials. So now we are sort of engaging people to get themselves. But of course, we also want to tell that it is better that it is taken under the Ayurvedic doctor's supervision. And our doctors will also on phone, they can give supervision. And also local Ayurvedic doctors can keep in their own pharmacies and dispensaries so that it is governed, because it's a medicine ultimately. And we will be happy that if there are any questions, now we can answer them.
Dr. Sankhe, my question to you and the team is, is this medicine to be taken as standalone or with the other allopathic medicines?
Yeah, right now we are promoting it as a adjuvant, or you can say additional to the standard therapy, because it is not yet tested solo. Alone, we are not yet tested. It is always tested along with the allopathic medicines. Later on, when we researched solo or alone, at that time we can say this officially.
Another question, Dr. Sankhe, because on the viewer's point of view, is this to be taken by healthy people or only those who had COVID or post-COVID people? I want the team to tell us, Dr. Nana Sahib, if he can tell us whether which type of people can take it, those who have had COVID or those who are pre-COVID or maybe healthy or those who are post-COVID.
Yes, actually, as we mentioned, the pathology breaking takes place as per Ayurvedic principle that it works on digestive fire of a person. As we see, Jivan Jyot means digestive fire. Rogaha sarve api mande agno. All the diseases, according to Ayurveda, except accident, are due to low digestive fire. And as we see, COVID attacks your digestive fire and reduces the appetite of a person. But here we want to mention is that even though person is healthy, he want to maintain his digestive fire nicely. So this medicine beautifully works on digestive fire even pre-COVID, contacts of COVID, during COVID, and after COVID also, because after COVID patients are very weak, even though they are discharged, but they could not eat nicely. So we recommend this in pre-COVID, during COVID, post-COVID, and even after post-vaccination also. Some mild sign symptoms are seen. There also we have seen in our some patients, it has actually helped a lot. So it actually works on digestive fire, so it can be given to all except pregnant ladies and small children. It should be under strict supervision. We can provide that.
Arvind, do you have any quick question?
Yeah, I have a question to the team led by Dr. Sankhe. Thank you very much. In fact, congratulations for doing this. But let me just remind you, when the corona broke out in the last March 2020, Patanjali also came up with a Ayurvedic formula, which later on is being marketed now as Coronil. And they also had given the proof of the trials in the Jaipur hospital, but later on that owner of the Jaipur hospital denied all those things. It's a controversy. I'm not going to that. I'm just saying my question is, this Ayur cure that you are mentioning, is it similar to Coronil, number one? Number two, the trials, in fact, Mr. Jagdish Shetty had asked this question, the two trials that you have, 87 patients and 60 patients each in the two groups, control and treatment, were they certified having through RT-RCR tests that they were corona patient? Number three, you have used a test called Mann-Whitney U test. This test is normally used for median, comparing of median of the two samples, not the average of the two samples. Any particular reason? Because this test is weak test as compared to the t-test, and why this test was used median, why median was taken, not the average? These three questions, if you can answer.
So to answer the two questions, I will answer regarding the Mann-Whitney test and regarding the RT-PCR, and another third question can be taken by Dr. Nana Sahib. So regarding RT-PCR, yes, sir, the first eligibility criteria for patient to get enrolled in the study is that the patient need to be labeled as COVID positive, and that too only through RT-PCR test. So as I was explaining in my presentation, the RT-PCR test was in fact done twice, before the administration and after administration also. The reason behind doing it twice is to see the difference. And this is a beautiful question, sir. And we could see a wonderful difference between the pre-administration and the post-administration. So RT-PCR, yes, was done to define the patient, to label the patient as COVID-19 patient. To answer your second question, the reason we did median was and not the average was to directly see the efficacy of these medications in both the groups. So we could have used the t-test also, but generally these are the non-parametric tests and which are done for the lower sample size. And in fact, we had the sample size which is more than 30 as you rightly mentioned, sir, the first clinical trial was with 120 patient, 16 age group, and the second trial was in 174 patient with the 67 patient, 87 patient age group. So these are the two answers. Now regarding the third question, I would request Dr. Nana Sahib to kindly share.
Yes, sir. So regarding similarities between coronil and Ayur Koro 3. So I would like ekam tattvam bahuda vadanti means ek satyam bahuda vadanti means many people speaks one truth in different ways. So there are many medicines, of course, because the Ayurvedic principle work on digestive fire. But I would like to highlight our thing because as we see, Panchagavya is considered as Amrut, and you will see the for immunity in Sanskrit word is used as Lakshmi. Lakshmi Karam. Lakshmi means immunity of a person. That is wealth as well as the body and mind immunity. So ghee, milk, cow urine, and all cow products actually they are considered as Lakshmi Karam immunity. Vardhak, they boost the immunity. First of all, main quality of all these products is Vishagnam. That point I want to mention is that because when COVID attacks the body, it affects all the doshas means acts like poison, and we see poison spreads very like wildfire. Similarly, COVID actually spreads like wildfire. It is like thief, but it spreads like wildfire. It affects similarly as per toxin, wish. And the medicine which we have actually very simplified medicine. Our medicine is very simplified, but it has the quality that is Vishagna, antitoxic, and you will see the toxin reaches the periphery of your body within minutes. Within 1 hour, the toxins reaches to the body. So the medicine which works antitoxic, it should have property the more speed than the toxin. So fortunately, the distilled cow urine, it is actually proven many times by even modern science. We could see even modern science also has proven, and our ancient science they were using as antitoxin for every place, for everything. And in fact, the metallic medicines in Ayurveda, all the metallic toxins, they are actually purified with the help of cow urine. Without cow urine, no Ayurvedic medicine which is made with metal can be done. So antitoxic effect of this medicine actually works within short time span because after the food, before next food, there are three time Kafakal, Pittakal, and Vatakal, and within 6 hours we target all the doshas simultaneously. This is the beauty of medicine, which actually I have experienced during this pandemic, and we could see the fortune of means I can share you one patient, control patient that is 6 liters of oxygen, and the patient which is in intervention, he was also having 6 liters of oxygen. Both were above 60 years, and we could understand how the intervention patient within night you will see the requirement oxygen was reduced from 6 liters to 2 liters, and this person which was on control group, it is one of the best standard care in our hospital. In fact, Kejriwalji also sent his team to observe our this standard care of allopathy care. Still we could find that the same person, he was within night, he was requiring 12 liters of oxygen. The changes we have seen, the second dose is gone and patient feels to eat. 5 days he is not eating, but within 2 hours, patient gets his taste back and he feels to eat. And as he eats, nourishment is there, nutrition is there, and immunity starts boosting, and this becomes weak. So this is our mechanism of action. So one day medicine, which and the authenticity of our research, I would like to thank Dr. Sankhe sir, because you should know Ayurveda research very hardly it takes place in severe cases, that is ICU. Fortunately, Dr. Sankhe sir and our ICU chest physicians, they allowed us entry into the ICU department. Please remember, there are many researches has taken place, but unfortunately, nobody was allowed into the ICU, which has taken place in our hospitals. I am very much thankful because according Ayurvedic point of view, they have kept faith and they have allowed us, and we have found the results. So it's like that.
Excellent. I have a question from a viewer, one of the viewers. So they're saying they're a COVID survivor, and can they take this for boosting their immunity?
Yes, sir. Yes, they can take that because post-COVID, due to many medications, maybe remdesivir and other medicines they have used, it actually affects the liver that is pitta, and even vayu also. So patient becomes very debilitated, and even I have seen patients 6 months So one of the lady came 6 months. She is having 130 pulse. Can you imagine? 70 pulse she should have. She is having 130 pulse and she is breathing through mouth. So this type of post-COVID effects are there. So where we are using this medicine, and uh, uh, we can use that on post-COVID patients also.
The other question is typically a lot of immunosuppressed candidates, like people who are cancer survivors who are undergoing therapy, things like that, their immunity is really compromised. So is there going to be an impact by them taking Ayurveda 3?
Yeah, so we have seen fortunately the contents of Ayurveda 3, that is distilled cow urine, it is actually, the patent also has been taken on anti-cancer properties of the medicine. So it is definitely used for those people because they are immunocompromised. This works wonderfully. This medicine can be taken.
And is there an age limit? There is no age limit to who can
Yes,
have
of course, there is age limit. Below 10 years, you need to have strict supervision because the dose needed to get finalized for the condition and weight of the person and even personality of the person. Because and afterwards, after 75 years, we need to check the weight and the condition of the person, comorbidities and requirement of that person.
Okay.
So
and
definitely
call you. One question.
Even for pregnant ladies, I think you need to strictly do under medical advice, Doctor.
Definitely. Because pregnant ladies, we have actually mentioned on our box that pregnant ladies should not take this medicine. If even if they want to take, they should be taken under strict supervision because in fact our text only doesn't allow this medicine for pregnant ladies.
Okay, so and if they have like if they have questions, they can actually go to their website or call the hospital.
Website, yeah, hotline is there, even phone number is there, even bhaktivedanthospital.com website is also there. There also they can get connected for virtual consultation.
Okay, I'm just going to quickly display something. I think this is the correct one.
Yeah. This is Ayurveda 3. It is 3 because it is only 3 dose formula. Ayurveda 3. So in fact, it acts on digestive fire.
Okay, thank you. I just wanted to make sure that this is the one. And viewers, you can actually go to ayurveda3.com and get all the details. And of course, if you have any questions, you can send them an email and reach out to them.
For the benefit of the viewers, can you have it again, Rameshji? For the benefit of the viewers, our YouTube channel will always have this video available. So you can always go and check up on this video. But very simple address is Ayuro, AYURO. I'm sorry, I'm correcting it. AYURCORO3.com is a simple address, but you can always have the video to watch out for this because a lot of requests are come to give us more details. You can go to the website and get all the details. Another question, a final question, because we have another part of the program. You are saying with allopathic medicine, you can take this medicine also, and you are also saying please go through the vaccination process. You are not saying that this will be a substitute for the vaccination. I just want a final word from you for the benefit of our viewers.
Dr. Sankhe sir, can you
unmute Dr. Sankhe sir?
Yeah. So Jagdish and for viewers, it is not a substitute of vaccine. We promote vaccination and proper. Those who are vaccinated also can get COVID definitely, but at a very lower severity rate. So vaccination is definitely a thing to be done, and this is not a substitute for that.
Okay, thank you, Dr. Sankhe, for that.
Dr. Swamy, you have any questions?
Yes, I do. But
Go ahead.
I'd like to start by saying that we are 9 o'clock. So I think the Pakistan thing can be done next week.
Okay.
If it's okay with you people.
Yeah.
Anything you want to say on this, Dr. Swamy?
Interesting. And in our country, we still have some inferiority complex about Swadeshi products. The standing committee member of the Health Ministry, standing committee for Parliament of the Health Ministry, that Covaxin was not cleared. And what was cleared was that Covishield, which now, because it's Covishield is not an Indian product, it is imported from England, Oxford Z, is the vaccine, and then here it is mass produced for sale. So we are an outsourced company which is getting outsourced by the British to produce their medicine, but as far as the Covaxin is a single casualty that is traceable to the medicine or even proximate, and it is has had no. I have taken it. I've already taken 2 doses of it, and all ministers, MPs are now only taking that. They said no, it needs a little more research because the power of the foreign lobby is so strong that they kept it out. Ayurveda, Ayurveda has come under literally under fighting every inch of the way. Everybody used to laugh about Ayurveda, but today it has reached a stage where there's a much greater acceptable. Know that every medicine, some less, some more, have some risk factor in it. It depends on the hygiene on the people who take it. So here is a product which is being produced in our own country according to own Indian tradition, and whatever you want me to do, Sankhe, you know how to get hold of me. I'll be happy to see that this become available in a large scale, so the people with the lower income can afford something which will but they will be able to. We'll be able to have service a very much large amount. So large numbers of people. Despite the internet problem, there's been a tremendous interest in the audience also. They've been sending in, and I think when you have made some more progress, you should come back here with a better internet availability. Plus, what further you have done, you should give competition to allopathic medicines. Also, you should give competition to foreign by Dadagiri, I called it, because I know how people like Bill Gates and so on have been able to get their way in our country for the medicines and pharmaceuticals. So thanks very much. We are very proud that our VHS President of Maharashtra is leading it from the front. And of course, he's already got an hospital where he's made a name there too. And we look forward to hearing from you. Pakistan thing is concerned, it will certainly take a substantial amount of time. So I think it's no harm, and I think the Pakistan, so it won't become out of date by next week if you decide to have it next week. Over to you, Jagdish.
Dr. Swamy, Jagdish, you're on mute. I have one other question.
Yeah, go ahead, Ramesh, please, before I wind up.
So the people are saying, can they take this along with other prophylactic treatment, Dr. Sankhe? Can you answer that?
Yeah, they can.
And they should not stop taking, and they're not. This is not a standalone medicine, correct? They're supposed to.
They can take it, but Dr. Rana Sahib can just give a little bit more explanation.
Yes. So I would like other prophylactic means if taking dry ginger decoction, so they need to stop the decoction that day they are taking this medicine, because we don't need all the hot medicines at a time, because every medicine which is working on digestive fire and we actually bombard all the medicines, then patient gets some problems, hyperacidity and headache like that. So we want to restrict them on that day when they are taking this medicine. So they should not take Ayurvedic medicines on that day. Even allopathy medicine they should continue as per their.
So I'm just displaying another question, Dr. Sankhe. You can, if you or Dr. Memani or anybody can answer, just say.
You say it can be taken pre-course, means it can be taken standalone, no need to take with allopathy medicine.
So can it be taken? So we should not stop allopathic medicine also that is being given.
Yeah.
Right?
So the whole idea is that we there is a legal issue in this, that this is not approved as such as a medicine from the Ayush Ministry. It is still approved as a immunomodulator right now.
Okay.
Even though it is acting like a medicine. So legally, we can't say that this is only medicine. So it will come to that level later on when it can be accepted like a medicine. So that's the hitch, and therefore we should take whatever is recommended by the doctors and add this.
Just like chapati, sabji, dal, rice, because all these products actually they are made with the Ayurvedic principles. Only the Afghanistan, India, Pakistan, Bangladesh, their people make all these things as per Ayurvedic consideration mentioned in the Samhitas. So as they are taking chapati, sabji, dal, rice along with allopathic medicines, they can take this medicine also.
The other thing, can a healthy individual take this as a prophylactic?
Yes, of course, we recommend this.
Go ahead, Dr. Vijay Kumar. You were saying something? No. Okay.
Yeah. Okay. So we have not yet published, but we have also done one clinical trial on the frontline healthcare workers. So we wanted to see that if this Ayurcro 3 is administered to the healthcare workers, because they are the most prone people, and we also have very encouraging results. We had given Ayurcro 3 for 3 consecutive months. So 1 dose per month for consecutive 3 months for around 120 healthcare workers. And surprisingly, 95% time, none of the healthcare workers contracted the disease. So I am not claiming here that it is going to be prophylactic, but this is my experiences with the 120 healthcare workers clinical trial.
And as of now, obviously, there are since a lot of viewers view from all over the world, I'm just telling you this is only available in India. So I'm just making a statement.
Yeah. Actually, in fact, as per consultation, we can send this medicine to any of our patients, because generally for Ayurvedic medicines, as we consult the patient, we know the personality of that patient, and as per that, we can prescribe our medicine and courier that medicine with the custom duties certificate.
Okay.
So it can be sent to all the country, all the areas.
Okay. So, but they have to call you and have to have a consultation.
Yes, of course, they need to do that, because legally they need to do that.
Okay. Jagdish, go ahead.
Yeah. Thank you, viewers.
Just one small point to add for the benefit of viewers. You mentioned the team of IIT Bombay. 2 years back, a team of IIT Delhi scientists also did a lot of research on Panchagavya, and they also came up with similar thing. Of course, it was not related to Corona, number one. Number two, a viewer had asked a question in the comments that you had a statistical test and the p-value was 0.0, not less than 0.05. Just to suggest to the viewer, on behalf of this team, the p-value I noted was 0.08. That means roughly 91% or 92% chances the results of this study are not by chance. So this is basically some kind of assurance given to the viewers who had asked this question. Thank you.
Thank you.
Thank you, viewers, and thank you the team of Dr. Ajay Sankhe, Nana Sai Memane, and Vijay Gauli from the Bhakti Vedanta Hospital for enlightening us on the Ayurcro 3, which was released or not released, which was mentioned in our today's program. I thank Dr. Swamy for giving his valuable inputs. We were to have another discussion on another topic related to Pakistan, because of time, and perhaps also because from Dr. Swamy's end, the internet of MTNL is horrible, and I don't know whether it is deliberately made horrible at this time of the day when Dr. Swamy speaks. That is another mystery which needs to be probed, and I'm saying this openly because very often during the time when Dr. Swamy is likely to come on this channel, Saturday evening and Sunday evening, something goes wrong, and MTNL is the only service provider of hybrid or service in the VIP area where members of parliament reside. I hope the MTNL concerned communication ministry or telecom ministry is aware of what's happening in Delhi. So we'll have the discussion on Pakistan on another day, but I wish to inform our viewers across the globe that today is the 103rd episode of Gyan Ganga. In a sense, the daily Gyan Ganga, which we started on 1 year ago virtually on 2nd of April, which was a Ram Navami day. And this is the first week of April. So actually 1 year we have completed. Earlier 2 months we had daily Gyan Ganga during the total lockdown, and then we shifted to the Sunday mode, which is like today's Sunday, we have it at 8 p.m. We also had a Saturday legal words of wisdom, which we did 21 episodes. And as you know, yesterday we completed the 5 episode of the economic words of wisdom. So total we have done 129 episodes of words of wisdom Gyan Ganga. And I thank our viewers across the globe from various countries across the globe where Indians and other people are settled, that they come and watch this program. And it's a great movement started by Dr. Swamy from Virat Hindustan Sangam. And it is held on our 4 social media channels of Twitter, Periscope, Facebook, and Instagram and YouTube. And I thank my co-host, Professor Arvind Chaturvedi and Ramesh Swamy. And I also wish to thank our technical team led by Ashish Shetty, Vishal Mehta, Ishwar Iyer, Tejas, and Rakesh Gadgi from Karnataka, and Swaminathan for Chennai, and our Virat Hindustan team members across various states and various countries who have been helping us in putting this program together. And Dr. Swamy, as usual, is there to guide us and give us interesting ideas and topics for discussion. So with this, thanking the Bhakti Vedant team led by Dr. Sankhe and thanking Dr. Swamy, I end this program. Hope to see you next Saturday with the economic words of wisdom, Arthik Gyan Ganga, and the next Sunday on our regular words of wisdom, Gyan Ganga. Thank you and have a good day. Dhanyavad and Jai Hind.
Thank you.